Instead of waiting months for relief, a person can receive relief in hours. And this is a game changer for someone who has been suffering from depression or PTSD, moral injury. Ketamine therapy is one of our tools in our toolbox for trauma. There are a lot of people who have been prescribed antidepressants, for example, but we know from clinical studies and from observations about 30 to 40% of people on antidepressants will be resistant. If you're treatment resistant, that means that the first line treatment isn't working, and then you would need something else to support you in your therapeutic journey. Ketamine works on the glutamate system, and when a person is under ketamine, within a couple of hours, you have your neuroplasticity that becomes much more, and it helps to break through some of those trauma responses that you might be having, like hypervigilance, flashbacks, all those trauma responses.
Anxiety attacks,
panic attacks, depression. Instead of waiting months for relief, a person can receive relief in hours. And this is a game changer for someone who has been suffering from depression or PTSD, moral injury, which is a huge one. We're allowed in Ukraine since 2018, since the XBO clinic was the first one, provide treatment-resistant cases with ketamine. It's a course of 8 treatments, 8 to 10 treatments, depending on the severity of symptoms. Come to the clinic, you go under an IV, and our treatment is unique in that there's a therapist there the whole time talking you through the experience. It becomes much more richer and easier to integrate. And then after the treatment, you have another integration session. You do that for 8 to 10. The work that we've done with veterans, the response that they've had under the treatment of no more hypervigilance, able to go back to work again. We had a guy who was an amputee, which is very difficult to treat because you're dealing with phantom limb pain, you're dealing with sometimes suicidality, and he was able to go back to having a stable mental state. There's a few clinics in Kyiv that are providing this type of care, and we're happy to be able to provide it because when people can't receive relief, it's the beginning of the end for many people.